Right, it's Dr. Jo again. Let's talk about the elephant in the room, testosterone. Now, testosterone is also made by the ovaries. Men make estrogen and women make testosterone. We make it in our ovaries as well as in our adrenal glands. But when we become menopausal, we stop making the testosterone source. And testosterone helps us with our sex drive. But that's not the whole story. It's infinitely more complicated than that. And I'm going to try and explain why over the next few minutes. We've talked about estrogen. Estrogen protects us from all the things, osteoporosis, diabetes, heart disease, dementia. We've already mentioned that. Progestogens protect us from a cancer of the lining of the womb if we take estrogen. If you haven't got a womb, you don't need to take a progestogen. So testosterone. If you have a high level of testosterone, it doesn't automatically mean that you have a high sex drive. If you have a low level of testosterone, neither does it mean that you have a low sex drive. That would be a linear relationship, and it's not a linear relationship. To explain what a linear relationship is if you've got a set of scales and you put a brick on a set of scales and it measures 2, and then you put another brick on a set of scales and it measures 4, you can predict that the scales are going to say 6 if you put another brick on the set of scales. That's a linear relationship. But testosterone and libido story isn't that. Lots of women we know have low levels of testosterone and no problem with their sex drive. Orgasms are great, no problem. And there are some women that have high levels of testosterone who don't have any sex drive at all. So what's going on? The first thing we need to make sure is we've treated the estrogen deficient symptoms properly and fully and completely. Because women don't use testosterone for their sex drive. They have sex with their heads. So do men, of course. But in terms of libido, testosterone, and this hormone replacement story that's going on at the moment, if we think about it, let's put it in simple terms. If the vagina is dry and sore, it sends a message to the brain and it says, I don't want anything down here. It hurts, it's dry, it's sore. Do not send the testosterone down here. So the brain is good. It doesn't send the testosterone down here. So the sex drive is switched off. And that's one of the examples of making sure we've got estrogen deficient symptoms sorted. Because what's the point in having testosterone to make the vagina even more sore? The other side of things is, as we get older, we're not so happy walking about in a thong. Our bodies have gone a bit south. We're not so confident. And that can impact on the way that we use our testosterone. We might have illnesses, we might have scars. We also might be suffering from anxiety and depression, the psychological symptoms of the menopause. And that's going to decrease our sex drive. You may laugh at what I'm about to say, but one of the commonest causes of loss of libido is that you quite simply don't fancy the person in bed next to you. And no amount of testosterone is actually going to change that. And finally, the far more complex issue, something that I get quite involved in and can talk about, is the psychosexual aspect of sex itself. If it brings back difficult memories of things that have happened in the past, perhaps difficult deliveries, difficult relationships, difficult conceptions, or even something that happened to you when you were a child, all of this can resurface at the time of the menopause. And no matter how much testosterone you have, it's not actually going to be able to work. So the message is, treat the estrogen deficient symptoms first and fully. Then look at the testosterone, have a conversation, think through those ideas, and we can do a blood test. And if the blood test is low, then you might benefit from testosterone. But if it doesn't benefit you, then you've got to go back to thinking about those other causes that I've just been talking about.